we are a few months away from 2025, and the changes to Medicare are going to be big. And they're going to change things like how, when, and how often Medicare beneficiaries can change their plans. So 2025 is going to be a healthy helping of good and a not insignificant amount of bad for Medicare beneficiaries. So here are 5 of the biggest changes that are going to happen to Medicare in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, give us a call at the information down below and we can help them make those tough Medicare choices. Now, up to this point, Medicare has been a pretty steady course of how and when folks can apply and how much they will have to pay when they utilize their coverage. But this year, 2025, is going to be a year where a lot of that is going to get upended. Yes, some people will pay less, but all will have less access to Medicare plans as a result of these big changes. So here are the 5 biggest changes to Medicare beneficiaries will face in 2025. Let's start off with a good one first, which is going to be really a benefit that Medicare beneficiaries who are taking medications are going to benefit most from. And the reality on a long enough timeline is that every one of us are going to be taking medications. But starting in 2025, the Medicare donut hole has been eliminated. Yay! And good riddance. The reason for this is buried deep in the Inflation Reduction Act from 2022 that is only taking effect now. What this means is that once folks get to the point in the yearly prescription medication journey where they would have hit that traditional donut hole and had a huge spike in their costs, well, now they won't. And in fact, they will hit the new maximum out-of-pocket for prescriptions right at that same point, meaning that beneficiaries will now only pay $0 for the remainder of the year for their medications instead. So a pretty fair trade-off, if I may say so myself. Another change, and I think it's going to be an improvement for Medicare beneficiaries that are going to go into effect as of 2025, is the loosening up of enrollment rules for those folks who both receive assistance through Medicaid or Medi-Cal, as is called here in California, and also are on Medicare. This is because previously, for the last couple of years, although these folks qualified for a special enrollment year-round, they can only exercise changes on those plans one time every quarter, save Q4. Starting in 2025, they will be able to change their plans monthly, meaning that if they try a plan and then that doesn't fit their needs or their expectations, they can move around much more frequently than ever before. I think a big part of this is because of the new and updated varieties of fully integrated Medicare Advantage plans that are going to be available as of 2025 for those folks, again, who have both Medicaid and Medicare. To go along in that same vein, the eligibility for folks who have both Medicare and Medicaid or Medi-Cal will have a monthly change option for their prescription medication coverage as well, or Medicare Part D. This means that instead of once a quarter when they can change, they will be able to change their Part D coverage year-round as well. The advantage of this is the fact that people's prescriptions change oftentimes as their health situation changes, but also because sometimes the prescription formularies change throughout the year on whichever plan somebody has, and the drugs can get dropped off or replaced or put together with generics that may not be as good of a fit for the beneficiary. With these new changes, now beneficiaries will be able to move their plan around and to have a coverage that better fits their needs and don't have to wait the 3-month period or wait till annual election period to make those changes. But for folks who have just Medicare, they're still gonna have to wait for the AEP period. So those are the changes that will probably be beneficial for Medicare beneficiaries in 2025, but not all changes are going to be helpful, because there are going to be some new restrictions as well put on beneficiaries who previously, just the year before, would have had much freer range to change the plans as they deemed necessary. This is because starting in 2025, folks who qualify for Low Income Subsidy Program, or LIS, or sometimes called Extra Help, are no longer going to be able to use that as an SEP to make changes to their plans outside of the AEP period. If you have watched our videos for any length of time, you will know I highly recommend applying for the LIS program to anyone who thinks that they might be able to use it, and I still do, because it helps to pay for some or all of the cost of Medicare prescription drugs. And previously, it allowed for an SEP to change their MAPD or PDP plans throughout the year, even if someone didn't qualify for other assistances like Medicaid or Medi-Cal. And it meant that somebody could have higher income and still get assistance paying for their medications and change their plans throughout the year. But that, in 2025, is being removed, and it will no longer provide an SEP to change those plans, leaving these beneficiaries still with help paying for their prescriptions, so that is good, but a restriction on when they can actually change their plan, which I think, will be kind of unnecessarily restrictive. Last slip today, and I think one of the biggest changes that is going to really limit Medicare beneficiaries' options, and this is really specific to our clientele, is going to be restrictions on those Medi clients who are now able to change their plans monthly. Now, that is going to be instead of quarterly, like I had said earlier, but they are going to be limited on the types of Medicare Advantage plans that they can actually choose using this SEP. By this, I mean previously a person who had Medi could choose a D-SNP plan, which are for dual eligible individuals, or they could choose a standard MAPD or standard Medicare plan, and there wouldn't be a problem. They would be able to use that SEP to choose either of those plans. Now, they cannot. Well, at least they cannot at any time throughout the year. So they will be able to choose a normal standard MAPD plan during the standard AEP period throughout the year, but they will not be able to use their year-round SEP generated by having both Medi to enroll in a non-Medi MAPD plan. They will only be able to use that Medi SEP to change to a dual eligible plan or switch back to original Medicare and choose a separate standalone Part D plan. Now this is going to be a big, hairy deal because not all plans are created equal, and D-SNP plans for Medis are good, yes, but they are not always the right fit. And now, if that is the case, it will mean that a person who needs the standard MAPD plan and are trying to use their Medi SEP, they will only be able to enroll in that standard MAPD plan during the AEP period and not all year round. Now, I'm sure there is a bureaucratic and financial component to why all this was changed for Medis and trying to push Medis into D-SNP plans exclusively, but health policy is a topic for another video. All right, so there we have it. Undoubtedly, 2025 is going to be a year of a lot of changes, mostly, I think, for the better, but also some new additional restrictions on Medicare beneficiaries, especially for those who are dual eligible. First, because fortunately that pesky donut hole is finally getting removed. Second is the ability for Medi folks to change their plans monthly. Third is the ability for Medi to change their Part D drug coverage monthly as well. Fourth is the removal of the SEP for LIS beneficiaries to change throughout the year, month to month. And last is the limitation of the SEP year-round enrollment eligibility for Medi beneficiaries to only be able to enroll in D-SNP or Medi plans rather than have access to all types of MAPDs, or I guess rather they have to wait till the AEP to do it. They can't do it year-round. Now, if you have any questions about these programs or really anything else related to which Medicare option might be right for you, please don't forget to like and subscribe and to follow so you can stay updated with the newest Medicare information, or also you can give us a call at the information down below, or just check out our other great Medicare content on the socials, on YouTube, on Instagram, because you have new Medicare content coming out every single week. So that's it for today for Michael's Medicare. I'm Michael, hoping that you have a great rest of your day, and goodbye.